Hi. So my name's Dr Ashish Patwala. I'm a consultant cardiologist at University Hospital of North Midlands and at the Nuffield Hospital in North Staffs. I was always quite science focused when I was young, and I enjoyed doing the science subjects. I wanted to do something at university that I could use to help people get better, and with a science background, medicine seemed to be the thing to go into, which is why I ended up joining it. In my early training that I liked doing practical procedures, and I wanted things that had a strong evidence base that they could significantly improve outcomes for patients. And those two things in cardiology really fit well together. In cardiology, we're lucky that we have lots of practical procedures we can do with huge trials showing that they are beneficial. And for that reason, I ended up in cardiology. I think the thing I specialize in is heart failure and complex pacing. And so we're taking patients who are often at a very low ebb in their quality of life. They're feeling very breathless, their quality of life has dipped, they're very worried about the future, and I can provide them with procedures that can significantly improve their quality of life, mean that they can get back to doing a good quality of life, they're less breathless, they're less at a risk of getting into hospital. For them, it's a huge change in quality of life, and for me, seeing that is the most rewarding thing I get. I think the thing I get most comments on is my communication style. That patients like the fact that I communicate with them in a nice manner, that I can explain things at a level that people can understand. That I spend time talking through the different options that are open to people and which one's right for them. That seems to be the thing that patients value most about me. In our job, you have to be reticent of the fact that people are putting a huge amount of trust in you as an individual. They're literally putting their quality of life and their life in your hands. You have to be very cognizant of the fact, and I often find patients will say to me, it's what do you think? What would you do? And I find that value of trust that they put in me the thing that I value most.